Thanks for joining tonight's conversation about autism. Tonight we'll be talking about autism and feeding, nutrition considerations. We'll be starting at 7 p.m. Thanks for joining tonight's conversation about autism. We'll be talking about autism and feeding, nutrition consideration. We'll start at 7 p.m.
Hello, and welcome to Conversations About Autism, a new series developed this year to create space for discussion with self-advocates, caregivers, and content matter experts. Conversation topics have been identified by and for individuals with autism and their families. This evening's discussion, the third in a series of 4 dedicated to feeding, will focus on nutritional considerations for those who struggle with eating and drinking. My name is Ashley Hosler, and I'm a behavior technician with Seattle Children's Pediatric Feeding Program. Tonight, I have the pleasure of guiding our conversation as we learn more from our experienced panel of guests. I'd love to begin with introductions and a very familiar question. What is your favorite food and what do you love about it? I can get us started. My favorite food, at least for tonight, is macaroni and cheese. I love the gooey texture, I love how cheesy it is, and I love that it makes me think of home. I'm going to start with Mateo, our self-advocate, and ask you, Mateo, if you can introduce yourself and share your favorite food and what it is that you love about it.
Hello, my name is Mateo. My favorite food is pizza. What I like about it is that it has a lot of flavor and that it has pepperoni. Well, at least the pepperoni type.
That's wonderful, Mateo. And earlier you shared that there are some things you like to add to your pizza too. Would you mind telling our audience what that was?
I also like to add like ketchup to my pizza. It makes it taste way more better. But just only ketchup and like Parmesan cheese. Anything else? I'm gonna pass.
We'll talk more a little bit about some of those foods that you don't like, but thank you so much for sharing pizza. I think you have many people on this visit who can identify and relate to that love of pizza. I'm going to pass it over to Bill and Lisa Lentz and ask the same questions. You can introduce yourselves and share your favorite foods or your child's favorite foods.
I'm Lisa, and this is my husband, Bill, and we are here representing our son, Gregory. His favorite food is Reese's Peanut Butter Puff cereal. We think that he likes the sweetness of it, and it holds its texture pretty well, so he can mouth it and suck on it and then spit out without having to worry about crunching or having it fall apart. Bill's favorite food?
Pizza. Yep. A New York style pizza that you can just fold in half and eat.
Bill, go ahead, Lisa. I'm so sorry.
And I like street tacos.
Also delicious. I was just wondering, Bill, if you add ketchup or Parmesan cheese to your pizza.
I will add Parmesan cheese and usually hot peppers also.
Ooh, very nice addition. What about you, Lisa? Do you add anything to your tacos?
I love like mango salsa or lime juice.
Delicious. Thank you. Thank you so much for sharing that. And our last panelist to introduce is Amy Frick. Amy, can you share your favorite foods and what you love about them?
Sure. My name's Amy. I am a dietitian. I previously was in Seattle and worked with the feeding program at Seattle Children's. I moved to Indiana about a month ago, so it is nice and late here, but I am glad to be here. My very favorite food, it's hard to pick, but if I had to pick one, it would be watermelon. And I like that it's sweet and juicy and that it reminds me of summertime and spending time with my family in the summer. And I usually add chili lime seasoning to it.
Very nice. Thank you all so much for sharing. I love talking about food. I know that we are going to get into some of the more difficult things about it, and of course, how we all vary incredibly in terms of what we like and what we don't like. And especially for the children and young adults that we work with feeding disorders. We know that there can be a lot of complicated feelings around food and eating. So I'd love to jump back over to Mateo and start off by asking, Mateo, if you could tell us what the hardest thing for you is about eating. Like if there are some foods that you really don't like, what makes them hard to eat?
Some things I don't really like what I don't really like is like broccolis or like vegetables and fruits. And what's hard about eating is that there's some foods that I'm like I do like, except that sometimes I don't have like the buds for it, like the taste buds for it. But also there's some foods that I really don't like it. Like for example, like some fruits and like some vegetables.
Do you like any fruits and vegetables?
I do like some like vegetables. I like broccoli. Well, ones that are only like warm and soft. I also like apples. I also like bananas. I also like grapes. The only thing I don't like about grapes is that I actually like take off the seeds every time when I eat them.
Yeah.
But I also,
I was thinking about seeds when Amy mentioned that she loves watermelons too, and how that can be.
And I do like watermelon.
You like watermelon?
Yeah, I like watermelon too.
Nice. Can you tell us some of the vegetables or fruits that you really don't like?
Okay, so some vegetables really don't have like flavor unless if you have like ranch or it. But even then, sometimes I still don't like it because it's like even though it has ranch and stuff, I usually like to eat it with like other foods too, like as a side dish or something. But if I just eat it by itself, it's kind of like meh.
It's a really great word to describe it.
And also for fruits, sometimes the fruits that I do like have like the good flavor, like the sweet flavor. And for bananas, it's like very like simple to eat and it still has like a lot of flavor. But for like some fruits that like do not have like really that much flavors, well, I don't. Well, I tried some fruits and I like tasted some and like some of them don't really have any flavors. So I usually just like tell my mom that I don't really like it. And yeah, what I really cared though is about like the taste. Like I really care about sweetness.
Yeah, that's fantastic. You know so much about what it is that you like about foods, those profiles. So flavor you've talked about, sounds like also some textures are maybe some of the things that you like or don't like about certain foods. I'm curious, if somebody asks you to take a bite of food that you really don't like, how does that make you feel?
Whenever like someone asks me to take a bite of the food that I don't really like, that I despise, I usually get like embarrassed because like my friend, like the person that is making me eat it, I'm gonna feel embarrassed for like not liking that food. For example, like if if I don't really like a food like Mexican food or like other types of food, and they tell me to eat it, I usually would just like eat it anyway. Well, cause like I just don't want to be like ashamed. I don't want them to be ashamed of me. Yeah.
It's very, very insightful, Mateo. You're incredibly thoughtful and articulate about foods and the way that you feel about them. And working with a lot of young adults with feeding disorders, I know that that can be incredibly tough. So I appreciate you being so vulnerable with us and so honest. Thank you. I would love to go over to Bill and Lisa as parents and caregivers of someone with a feeding disorder. When did you first become worried about your son's eating? And in general, what's been kind of the most difficult throughout that journey?
I think we first, it was like day one, probably. We realized he wasn't, well, I guess after a couple of days, you realized he wasn't gaining weight. And so we knew that we needed to do something nutrition wise for him. And so I think right from the very beginning, we knew something was different. And the other question was,
yeah, what in general has been difficult throughout this feeding therapy or feeding journey?
Oh yeah, go ahead.
Just making sure that he gets any nutrition in him. He for up until this feeding therapy session, it's been difficult to get him to eat anything. He doesn't want to eat. He didn't have that hunger. I'm feeling hungry. Feed me. So that's been the biggest challenge, I think, is trying to make sure that he gets the nutrition he needs, because it not only does he not want to stop to actually eat, he would fight when we try to feed him.
Yeah, he was recently diagnosed with food aversion, which we thought was interesting. We'd never heard of that before. And so just the taste and some of the things Mateo talked about with just the taste and the texture of the foods just is so much for him that he can't handle it. A lot of different flavors, like Mateo was talking about.
And the pleasure of knowing your son a little bit, and would love if you could share with our audience kind of what is in his food repertoire and what kinds of gains has he made in therapy.
Go ahead.
He has his normal meal is a puree that's made of coconut yogurt, a baby fruit and vegetable packet, some chicken,
Buddy.
and then egg yolk. Egg yolk is with his syndrome. Egg yolk is he has I think about 10 eggs a day worth of egg yolk to try to get cholesterol into him, because he doesn't absorb the cholesterol like most people. So that's a normal meal there. It's all mixed together in a puree.
And it's pretty recent that you're learning that he loves those Reese's peanut butter cereal pieces.
Well, for a while, a couple of years now, he's been willing to suck on those, and he just actually walked over one day and picked one up, and so now he'll actually ask for cereal and kind of snack on it. He doesn't eat it; he just sucks on it and then spits it out. He still doesn't actually crunch anything. That's one of the goals we're working towards. But since we've started feeding therapy, we've got him into some different flavor profiles that he would refuse to try before. Something as simple as chocolate pudding or anything chocolate, he wouldn't eat. With Lauren's help, we've come up with a mixture that kind of matches the flavor profile of the Reese's cereal, and I think that's probably become his favorite meal at the moment.
That's fantastic.
Once he tried something he really liked, he's been a lot more open now to some other choices. But until we got something pureed that he was like excited about, we haven't been able to deviate from our like recipe much.
Yeah, almost like a gateway, right? Like he was willing to start trying something new, and that's maybe made it so that he's more willing to try a variety of things going forward. I just wanted to share, Bill, since you had mentioned Lauren. Lauren is the nutritionist on your case currently, but I think this is a lovely segue to bounce over to Amy as well, who is a nutritionist and can answer a bit of questions for us. Amy, I would love to know more from you as a professional in this field. What nutritional considerations do you often see in autistic individuals with feeding challenges?
Yeah, that's a great question. You'll see a variety of circumstances and presentations, but I'd say some of the common ones are, I'm so lucky to be the third one to answer a question about this because we kind of already brought up some of the things I was going to talk about. So sensory specific preferences or, a flavor profile versus a texture or a temperature even. Sometimes color and presentation is important. So kind of learning more about what is good or desirable for each person I work with, and kind of working with that. So how you guys are saying that you found a flavor profile and were able to kind of expand upon that for Gregory, and that's something that we would definitely learn about someone and want to work with, and expanding flavors that are similar. So we're not asking to reinvent the wheel. We're trying to work within the wheelhouse and make someone feel comfortable, but also extend the flavor maybe just a touch or the texture just a touch. So it's always fun to learn that about people and about yourself too. And so other things that you see kind of along those lines is rigidity in eating patterns or places or, specific meals at specific times. So kind of just learning that about someone and why that is, or how flexible that might be. Because if it's something that is pretty important to someone or important to a family, that might not be something that we will want to start with maybe, but we'll work towards what is most nutritionally going to impact them in a positive way. And so sometimes with that rigidity and those patterns of eating, that might, exclude a certain food group that might impact kind of maybe bowel movements or mood or hunger. And so trying to make it as balanced as possible within those preferences, but also trying to get as many of the nutrients that we can from the foods that are, that are accepted by an individual. So that's, I think, an area of expertise that dietitians can bring, knowing we learn so much about foods in our schooling and our training that we usually know which foods have iron or calcium or vitamin D. And we can kind of help work towards encouraging those foods if there's maybe a lack, and trying to find one that works for one or two that maybe work for that individual or that family. One thing I think that was, important to me to learn about, this population and feeding disorders and autism is a lot of times packaged foods or like restaurant prepared foods that are very consistent are important to an individual because they're going to taste the same every time. They're going to feel the same every time. They're going to look the same every time. And I oftentimes feel shame coming from either a patient or a family when they tell me, oh, my kid loves, this packaged food. I know it's probably not healthy for them, but it makes sense to me that someone would seek that consistency out, that, that sameness every time, because it is going to be the same versus, let's say, a blueberry in August that you picked off of a bush in right outside of Seattle is probably going to taste pretty delicious. But, in December, from the grocery store, it might not taste that same. sweet or tart or whatever you like about that food. And the texture might be a whole lot different. The size might be different. The color might be different. So asking someone to have that flexibility isn't always possible. And it's not something that is often what patients like. So that consistency is helpful. And I think that's kind of a thing that our bodies have adapted to over time. That's a safety concern that long ago we think we might have built up in nature to learn that something might taste sour, and so then it might not be good for us. So some people I think still have that in them. So a lot of times those packaged foods, it makes total sense to me why someone would choose that. So other things I see oftentimes nutritionally is constipation, and I feel like that impacts your hunger and your satiety and your intake and your willingness to eat, your comfort level with eating. You might not have positive associations with eating if you don't feel like you want to eat. I always talk about it as basic plumbing. You're not going to want to put more stuff in if it's not going to be coming out. So I think managing fluid intake and being aware of how to fit in fluids and types of fluids that can help with that, as well as foods that might have more fiber or more help with motility. That's also important. And activity, if possible for an individual, can also help kind of things move along better. So and then, kind of more specifically, I think specific nutrients, I touched on this earlier, like if someone maybe doesn't seem to be getting enough calcium in their diet, that could be something we work on maybe through food first, and then if not, maybe through a supplement or a drink, and work towards trying to just make sure we're hitting all of those big nutrients that help our bodies function properly, and our full nutrition panel is working and helping us.
Fantastic. Thank you so much, Amy. That's a really wonderful overview of all of the important things that nutritionists can do for any of us, and in particular for our audience on the spectrum who often have challenges, as you had mentioned, with rigidity or with needing things to be predictable. And as you mentioned, that benefit of having those predictable flavors in prepackaged foods or in food chains. That is something that we see quite a bit for sure. I have so many more questions for you. I just also want to let the audience out there know, if you have any questions, please feel welcome to throw them into the chat, and we can address them as a group. So Mateo, I'm going to come back over to you. I would love to know what kinds of things make you feel comfortable when you're at the table. Like, what do you like to have with you during meals?
What makes me feel comfortable at the table is that, like, when my family is there, when it's calm, when there's no like distractions or no noise, when everything's just calm and we're just all happy, and when like we actually got good food, and I could just I can relax, and at the same time I can enjoy my food without feeling like I have to be rushed.
That's wonderful. You like to take your time when you're eating?
Yeah.
Being surrounded by family and people you love that make you feel comfortable, it's a really wonderful thing to have at meal times, especially if eating is something that causes you some stress, right? If it's already tough, it's really nice to be able to have a group of loving, caring people around you. So fantastic answer. Thank you. I'm curious, Bill and Lisa, what are some things that you do to ensure that Gregory is comfortable during meal times?
I think we started off just making sure that everything is really consistent. And some of the things that Amy brought up really resonated with me, in that I started trying to make all of Gregory's food. And so I would buy the fresh organic produce and blend it and freeze it, and then we would mix it all together, and it always tasted slightly different. And I had to give that up to just know that the packaged stuff is always very consistent. It tastes the same. And it took a little bit of while, it took a while for me to kind of let go of that guilt of, I know that I could make it, without the preservatives and but it doesn't do any good to make it if he is not going to eat it. So just the consistency, really, specific bowls and spoons. We've tried a lot of variety of things. And then once we found things that he was willing to do 2 or 3 or 5 or 20 times, we've just stuck with it. And then as we've progressed, we've been able to get him to like deviate from a specific bowl or a specific spoon. But at first it was just very consistent. The schedule that Amy was talking about, we had an alarm set and he ate every 2.5 hours when that alarm went off. And so everything revolved around when he would get that food. As far as just behavior sort of implementing.
Like the thing we had to do is try to make him as relaxed as possible and try to find something that would allow him to enjoy sitting at the table. So
similar to Mateo, like having it be this relaxed environment, minimal distraction, so no noises. He has his back towards a wall or a window so that he has access to see everything. So that means that everything needs to be like off and away.
Yep. And then he's also, because of his aversion, him having being able to get a reward for eating so much. That was a big, when we understood the need for that was a big change for him. So he's got a laptop or an iPad that he's allowed to play videos on and stuff. So he'll have, X number of bites, and then, okay, now you can have a break, and that him being able to have some control and have those breaks has been a big thing for him.
Especially as he's gotten older. He's nonverbal, but uses an iPad, the Proloquo, and some basic signs and gestures in order to communicate with us. So the more control we've been able to give him during that process, the better it's worked out for us, especially as we're trying to, he's a teenager now. He's almost 14. And so trying to get him past what he needed to grow, as an elementary student to what he needs as like a young adult. So allowing him to be able to communicate break. And so we can say, okay, 2 bites, and then you can have a break. Yeah.
That's incredible. Yeah, thank you. You shared so many fantastic strategies that, I know for those of us who are working in the program and families like yours who are part of the program have started to become more and more familiar, but maybe aren't to a lot of families. So thank you for sharing, the benefits of having those routines and that timing, that reinforcement at the table. And then both of you really expressed how important that break time is and giving him the autonomy, right? That ability to be able to say when he needed to take a break. I think those are really fantastic strategies. So thank you so much for sharing those. This lends perfectly to the question I was going to ask Amy, which is just what are some of your top recommendations to setting up successful meals?
Yeah, and I think a lot of the things I've learned since working with the program and working with behavioral specialists like yourself, Ashley, is the behavioral side of things. But from a nutrition standpoint, I think the routine is probably one of the most important things that we try to start with and kind of set a foundation. So for a lot of people, the natural body cues for hunger are somewhere in that 2.5 to 3, maybe 4 hour time frame. And so eating about from when you wake up to when you go to sleep, eating generally in every 2.5 to 3 or 4 hours is helpful for teaching yourself those hunger and satiety cues. And then we try to have a lot of discussion surrounding what does hunger feel like to you? What does satiety feel like to you? And trying to acknowledge what that is and how that impacts your eating. or your mood or your desire to eat new foods or try new things. Because I think of it as, if I'm very, very, very hungry, I'm going to want something that feels good in my body and I know how it feels. So I'm probably not willing to eat a new food or a non-preferred food at that time. And also when I'm not very hungry, maybe I just ate an hour ago and had a big meal that filled me up. And if you're asking me to eat something, just a little bit after that, I'm probably, also not going to want to eat that. So if I think of a scale of 1 to 10, keeping your hunger and your satiety somewhere between like a 3 and a 7 or 8, kind of in that middle range, trying to not let your body get too hungry or too full, not letting that tank get too, over full or get onto empty, because that's just not setting our bodies up for success. So that routine and that discussion around hunger and satiety is usually one of our first steps and one of the most important things, I would say. Also learning kind of what a proper portion size and what a proper expectation is. So that's something that a lot of times we will try to, teach and give the tools to learn what would be the appropriate portion for each food. Because if we're eating 3 portions of something, then we might not be hungry in that, 3 or so hour time frame. So the expectations surrounding portions, I think, is helpful. And then I loved you set this up. I think Lisa said it, for trying to just continue to offer foods in different ways. And sometimes it takes 5, 10, 15, 20, 100 times before something is accepted or is maybe the exact right specifications for someone. So that practice and maybe getting it closer location wise towards that person, or getting it, in the right shape or right color. So trying to just continue to offer on repeat if needed. And then one kind of tool I like to utilize is having, involvement from the person with the feeding issue. So having, either grocery shopping assistance. It's amazing to me how many times parents just, haven't even tried to take their child to the grocery store to look down the aisles and see if maybe something jogs their interest, maybe a package or a different fruit or vegetable that they've never seen before. So sometimes if that's a step that can be involved, or whether that's involving them in, cutting up the foods, or putting the peanut butter on the bread, or however you can involve age appropriate in the kitchen or in the feeding process, I think can be a helpful tool as well.
That's fantastic. Yeah, thank you, Amy. While you were sharing, we got a question that is related, and I would pose this to anyone in the group who wants to respond or answer. But the question was, can children overcome food texture issues? And any hints while we wait for therapy assistance?
So that has had to overcome a lot and continues to overcome. We started with the Kid Boost Essentials, and so we were able to do just limited amounts of pureed. So like Amy was saying, we weren't giving him a whole bunch of puree and expecting him to eat this huge meal. It was really, his meals were the Kid Boost that we were getting through Seattle Children's with the dietitian's help, and then just small bits of the puree. And we found a puree like consistency or thickness that he would tolerate, that wasn't something he had to chew or manipulate really like with a lot of effort. And then it was really just like a thick drink that he could just drink, because we knew he was doing okay with the Kid Boost. And then eventually we just started adding like baby oatmeal, and that gave it just a little bit thicker consistency. And then we've been able to play around and manipulate with other, crushing things. I think we've crushed cereal in it before and things like that. But just baby steps. And then there will be times when he's like, nope, I'm not having any of that. And then we just back off and say, okay, you don't have to, you don't have to have it this time. Or just because it worked once doesn't mean it's going to work again. And I think Mateo said this, that it might be okay. It might not be okay, but like just keep trying. Maybe Amy, that was you that just said, keep trying it. Eventually, maybe they'll tolerate some of it.
Yeah, it took us probably 3 months, maybe a little longer, to get chicken breast added into his puree.
Yeah.
So it changed the flavor and the texture just enough that it just took that long to get him to where we could get the amount in there that the nutritionist wanted.
And it was like teaspoon amount for an extended period of time, and then adding another teaspoon. And then at one point he had gotten sick, and so we had to scratch that and go back to the beginning puree and start again. But just over time, it has just taken a long time and a lot of, I think, patience and tolerance on his end and ours.
Yeah, thank you. So well said. And absolutely, as the provider, I can confirm that, for us, that slow and steady approach, we want to make sure that the kids that we're working with know about the changes, right? That nothing's a surprise, nothing's secretive, nothing is thrown into their foods without their knowledge, and that the trust is a really big component. So taking those small steps, and we're I love seeing Bill and Lisa's response to that. But really just working on meeting your child where they're at, and going slowly, making those changes just periodically. What might not seem like a big deal for us, for someone who does not have a feeding disorder, is for the children and young adults that we work with. And the other thing I just want to share, next month, our Conversations About Autism is focused on the behavioral side of the work that we do. And there will be a lot of talk about that. Lisa and Bill had already mentioned earlier some of the strategies that they've learned, but kind of goes hand in hand with some of those small steps that you can take to kind of, again, make sure that your child is trusting those changes that you're making, and that you're not doing anything too quickly that's going to make it so that they're unwilling to try. But of course, repeated exposure, lots of practice, and just lots of opportunity to, have your child say, tonight's not the night that I want to try it, but maybe we can try again another night. Amy, I see you came off mute. What would you love to share?
I totally second the slow and steady small changes, and keep the trust there. I think that's a misconception. I hear a lot of I hide, X, Y, and Z into, this puree or this smoothie or this food. And once that small change is made, that might break the trust. So second all of that. I was going to give an example of, it isn't texture based, but I think it would be, could be another way to think about it. Is I had worked with a behavioral provider who we were working with a child who had a temperature preference for a warmer drink. And it was kind of a thing that was hard for the family to manage when they were, on the road, or so there was something that they were hopeful to be able to make an adjustment to, so they could have more flexibility. And so they started with their usual microwave time of that drink was 40 seconds. And so the next day they tried 39 seconds. And then, a couple days later, 38 seconds. And slowly but surely they got down to about, I think it was 20 seconds or so. And it no longer really had any warmth to it at that point. So it was that same slow and steady, pattern that I think is helpful.
Fantastic. Yeah, thank you. It's such a great story, and such a great way of kind of, again, just reiterating, going at a pace that makes sense for your child. The other thing we talk a lot about are, sensory characteristics and properties of the food that we do like, and that is something that we can all appreciate. For any of us, we might crave those dry, crunchy textures, or we might be someone who, wants those soft, gooey kind of foods, right? So I would think too, in terms of just kind of expanding your child's texture preferences, just starting with where they're at and how many things within that same kind of texture characteristic or property can you expose them to, and then what small changes, just like Lisa was sharing, in terms of like, what can you do to just ever so slightly change the textures by adding something else in, or by presenting it maybe in slightly larger pieces so it's a little bit more crunchy, whatever the case might be. But there are those small changes you can make that over time will help along with acceptance. Thank you so much. I want to head back over to Mateo. And because we do so much work with children and young adults, it's always really important that we all have a sense of why it is that we're doing this work and why we're asking you to do those really hard things. So Mateo, I would love to know, what do you think food and eating does for your body?
I think that food and eating, what it does for my body is that it like stops giving me like hunger. Like whenever I don't eat for like a long period of time, I eventually will get like hungry, and I usually eat like something to like stop the hunger. And also like the foods, they also sometimes do bad stuff for your body. Like for example, if you eat too much, you could probably like vomit or some. And also sometimes you can also like get diarrhea sometimes. And like you can also sometimes like if you eat like too much, like a lot for like a long period of time, let's say for like about like a year, you're eventually gonna get overweight.
For
Yeah.
sure. Yeah, food does a lot of things for your body, and good and bad, right? You shared some really great things like providing that energy, as well as making you feel uncomfortable or making you feel unwell sometimes, right?
Yeah.
Mateo, a question has come in specifically for you that is about the food that you eat now, and if any foods have changed since you started therapy. Is there anything that you didn't used to eat that now with some practice you are eating?
Um some foods that I didn't used to eat and up until like this point is that like broccoli, because I didn't really like broccoli before the class, or like a little while ago. But now I actually like it, and then now I eat it a lot with my plate. Most likely the foods that I used to didn't like a little while ago. For example, like apples, bananas, and like watermelon. Now I do like.
Yeah.
It's most likely because like the older that you get, the more like taste buds you lose, and the less sweeter things will become.
So yeah, so as you've aged, you've noticed that your tastes have changed, right? So maybe that helps you to learn more things that you do like to eat, and maybe even some things that you don't like to eat that you used to. It's pretty incredible that you are now eating broccoli and apples and bananas and watermelon, such a range of things that at some point you didn't like. What kinds of things do you think helped get you to a place where you did like those foods?
Um, Probably like eating like a lot of it every single day. Although it kind of sounds bad for like some reasons. If you do eat it like every day though, eventually you'll start to like it.
Yeah, so that practice that we were talking about,
Yeah.
yeah, being presented over and over. Mateo, another question has come in for you, very popular this evening. And the question is, are there certain textures that you got over? And if there are, how did you get over them?
Um, the textures I got over with are like fish textures. Um, Anything like that feels like too rough for my digestion. For example, like hard meat. Like when I try to eat it, it sometimes actually hurts my teeth. And wait, what was that other question again?
Yeah, no, that was it. You're doing a fantastic job. Just the question of how you trained yourself to like eating or to accept eating different kinds of textures. How did you get over the things that you didn't like?
All right, I got that question.
Yeah, you sure did. Thanks for sharing, Ben.
You're
And
welcome.
I agree. I remember we were talking about meat. That's one of those things that we talk about as being very effortful. And that's a difficult thing. There's a lot going on in your mouth to make sure that you're, tearing down the meat and processing it enough so that you can swallow it safely. So I completely understand why that would be a texture that is uncomfortable to eat or to accept.
Yeah.
Yeah, thank you so much. Go over to Lisa. I know earlier we were talking about, you shared that with Gregory, you noticed, concerns with eating almost immediately. What were some of those first steps that you took when you noticed that there were feeding challenges?
We started with just the regular primary care doctor, and then our own gut instinct that told us that the information we were getting from some of the professionals we were seeing weren't going to work for us. And so seeking out other professionals that would help us. So we got in touch with one who got us in touch with another, and so on. And that's actually how Gregory got his other diagnoses. So that was super helpful. Just trusting that we knew that the information didn't work for our family, or it did work for our family, and continue to seek outside sources until we felt like we got what we needed.
Yeah, and you, I know you had mentioned his other diagnosis. By chance, is that ARFID? Is that the diagnosis he's received?
No, Smith-Lemli-Opitz was his umbrella diagnosis.
Okay. Thank you for sharing that. I know that a little while ago I missed a question in the chat about ARFID. So for those who are listening who are unfamiliar, ARFID is a mental health diagnosis that falls under pediatric feeding disorder umbrella, and it stands for avoidant restrictive food intake disorder. It is fairly new in DSM-5. If you are wondering if your child has feeding disorder, specifically ARFID, it's worth checking in with your primary care physician and possibly receiving a referral to a mental health specialist who might be able to help diagnose that. But like I said, next month we'll talk a lot about the behavioral side of it, and ARFID will fit perfectly within that conversation. But really pointing out that it's, not for those who have ARFID, it's not just about texture or, having limited variety, that there is a lot more, in terms of the mental health and psychological side of the feeding disorder that makes it a lot more challenging. And again, to just reiterate the importance of that slow, steady, that if there's something bigger going on that makes it so that your child has a really difficult or negative experience, a negative history with certain foods, that's going to take a bit of time to undo and to work through. Thank you so much, Lisa. Amy, this is a question that I am so excited to hear you answer, and it's about the idea of good and bad foods. Is there such a thing as a good food or a bad food?
And I love getting that question because I feel like what people would expect a dietitian or maybe just me answering is, oh yes, there is, but no, there's really not. We don't want to categorize foods as, good and bad. I think there are foods that maybe should be eaten more often and less often, or should be, more consistent, or maybe do a different purpose in our bodies. But I don't think there's, just can umbrella statements say that these are good foods and these are bad foods. It's more nuanced, more of a bigger answer than just that. So I would encourage everyone to not try to categorize foods as good and bad, or definitely never eat. But definitely there's foods and drinks that maybe we shouldn't have every day and all the time, and that maybe don't benefit our bodies as much. But everything serves a purpose. And I think, one food could, negatively, you could have an allergy to a food or an intolerance to a food in one person. And then it could be, really helpful for another person that maybe has a certain, disorder, or, has a something with their digestive system or something. So that's the art and science of nutrition, is, being able to apply that knowledge to each individual. And so that's why we are here, and why we try to help. Is it's not ever just a simple answer, and there's not a prescription you can really write to one person that will translate to the next person, because it's there's just so many options out there, and so much culture and things that go beyond what eating does for our bodies. So such a important question to address, I think.
Yeah, because everything is so individualized too, and because we're all so unique as it relates to our interest in foods or disinterest with food. Is there one or several nutritional recommendations that you would make to kind of help with that understanding that something that works for one person is not necessarily going to work for someone else?
Yeah, absolutely. I think my first step anytime I meet with a new family, and I'm glad, Lisa, I'm glad you kind of addressed that already, is to kind of get your family's goals and what is most important to you to address, because that is vastly different from person to person, and the resources they have, the time they have to devote to, a feeding issue, the knowledge level maybe they have behind nutrition and food. So I really want to delve into the goals of the family and the individual, and learn what is important to them and what is feasible, because that could be vastly different from what I'm looking at nutrition wise. But I also want, maybe if there's something that I think nutritionally would impact some of their goals, whether that's, hey, I think if we can increase the fluid intake that you're doing, maybe that's not on their list of goals, but maybe their list of goals is to not have stomach aches anymore. So that could be a way to help out that goal. So I always try to take into consideration what's important to the family and what's important to the individual. And yeah, like you said, every situation is so different that it's hard to give like a prescription to just the diagnosis in general, or just anyone with a feeding disorder. And one of the things that, as a dietitian, and I think the medical providers also try to just monitor, weight gain or growth in general on that person's trajectory, to make sure that we're still, on their goals for keeping their body going the way that it should be going. And that's different from every person too. And so that's an important step, I think, as a dietitian that I do on the team versus maybe some of the other providers. And then I love that's both, I think Mateo and the Lentzes have mentioned already, having that calm, low pressure at meal times, because I think that is an important step, that if someone's coming to a dietitian or a feeding team with maybe an issue or a problem to solve, they probably have some stress surrounding that situation and are seeking help. So I can appreciate that that's probably going to be there before they get to me or get to our team. And so having, as much as possible, helping that stress and that pressure be eliminated or lessened as much as possible, because I think that helps the situation a lot to find those things that make a peaceful environment and make that stress level go down around meal times. And I think that positively impacts intake and variety, and the relationship with eating and with the caregivers too. So and then kind of a lot of the things we've already talked about, as far as like routines and timing of meals, and the plate that we look at, and trying to build something that's as balanced as possible, because all of the types of foods versus, protein versus fats versus carbohydrates, and those fruits and vegetables and our liquids, all of that, kind of coordinating that to best work with our hunger and our satiety. If we're eating a lot of those quick starchy or quick sugary foods, that's going to digest really quickly in our bodies, and our energy levels, are going to go really quickly up and quickly down. So if we add maybe a protein to that, if we're able to, that might not spike our hunger quite as much, and it might have us be a little bit more satisfied longer. So those are things that as a dietitian, I try to look on pairings of meals and work with families and individuals on having a variety within their own scope or their own already loved foods of those categories to balance that out. So there's some nuances that I'm doing behind the scenes that I'm trying to not involve other team members or the family members to think about, but I just want to support to work on that hunger and satiety and timing to best set up the goals that are trying to be achieved with the program.
Fantastic. Yeah, thank you so much. I am noticing our time, and this hour has just flown by. So I want to be able to check in with all of our participants today with one final thought or one final question. And so Mateo, I'm going to jump back over to you. I'm just curious. You shared earlier how much your food interest has changed and how much you are more willing to eat things that maybe you didn't like before. What are you most proud of with the progress that you made?
What I'm most proud of is that now I can eat like other foods that I didn't used to like. For example, like any food that I didn't used to like that's actually healthy and that's like actually helpful to eat, but I didn't like to eat it. Now I can just eat it. Like for example, like probably if the food has some vitamins,
Mhm.
and I didn't usually like to eat like that food that has vitamins, but now since I like lost a little bit of taste, I can finally like eat it without hating it.
Fantastic. Yeah, it's good to know too that some of the things that maybe you didn't like before that now you're eating are doing really good things for your body, providing some of those nutrients that you might not have gotten before. It's wonderful. You should be very proud of yourself. So thank you for being able to share that with us. And Bill and Lisa, with Gregory, what are some of the things that you're most proud of, not only with him, but with yourselves with going through this feeding journey?
I think just relying on the team that we have around us to help us navigate it. I know, Amy, you mentioned letting go of some of the stress and that expectation and just allowing the mealtime to be what it is. It's going to be what it's going to be. And putting extra pressure on yourself and putting extra pressure on Gregory just makes everything exponentially more difficult. But we've been able to get him from only Kid Boost Essentials, as a toddler, that was all he would drink is that formula, to now he's holding a spoon, tasting different textures and different flavors, even at the same meal. And so you want to add anything?
Yeah, and for us, the feeding therapy, this is, I think, it's probably the third time we've been through a feeding therapy.
I think fourth, but yeah.
Maybe fourth.
Mm-hmm.
And we never really made progress until this time. And I think a lot of that is just continuing to try until he was at the point where he was willing to work as well. The fact that he'll hold a spoon now, he'll hold a cup now, he'll take his own drink. He's even coming to us now and asking us or telling us when he wants milk, especially. That's he never would do that before.
And picking it up himself and drinking it himself and setting it back down before it was us just be like, okay, we'll hold it, but just please drink some.
It's always felt like we were, forcing him to eat.
Yeah, we were doing it to him. He wasn't a participant.
Exactly, doing it to him. So now he's a participant, and with the help of the feeding team, we're exploring new things, and he's willing to try things that he wasn't would not try before.
Yeah, and even things that we see as like as really small step, like we hardly notice that the progress has been made, is huge for him. So even though some of the therapies we felt like we didn't really make a lot of progress, well, we didn't make a lot of progress in our eyes, but when you look at where he's at now compared to where he was, there was progress being made. We just didn't see it maybe as big as we had expected.
Yeah. Oh my goodness. I love that. That's so beautifully said. And in the last few minutes or so, a question popped up about just kind of sharing family's experience with a child who has a lot of sensory issues, who doesn't, like the weight of the spoon or the fork, issues with texture and smell, look and taste, not wanting things to be touching, generally asking, is that something that they could get help with? And it sounds, Bill and Lisa, a lot of what you just shared was exactly that there is a lot of gains that can be made. It might be slow moving. It might take a lot of practice, but it sounds like Gregory and both of you have worked really hard over the years to change what he's willing to do and to take those steps to, hold things on his own, to initiate his own hunger, to be willing to try new things. So sounds really hopeful, really promising. Thank you. Amy, we have about 1 minute left. Is there any final thought you want to share before we hop off?
Yeah, I would say kind of just the first steps to take if you maybe haven't addressed any of the issues and you think there may be some nutrition concerns, definitely talk to a medical provider, see if there's issues that can be brought up or addressed, and see if that is impacting eating, and if maybe something like a multivitamin or a specific vitamin or a change in food or talking with a dietitian might be helpful, and just working on those routines so the body kind of learns their hunger and satiety, and that conversation around hunger and satiety, I think, are good first steps to take, and that low pressure at meal times too. So those are kind of key takeaways, I guess.
Fantastic. Thank you so much. I'd love to thank all of you. You've been a really fantastic panel, and just so much fun to spend the evening with. And thank you to everyone who's joined us tonight.